One of the major approaches which institutions are utilizing to control multi-resistant drug organisms is universal daily bathing with chlorhexidine, but there are concerns with the development of bacterial resistance. Researchers have recently reported data indicating that chlorhexidine bathing may affect the incidence of genetic resistance. The genes encode for efflux pumps, which can cause resistance to multiple types of antibiotics. These pumps may be giving a selective advantage to CRE and may well become a driver of the antibiotic-resistant epidemic. A number of institutions are using MIC testing to detect antibiotic resistance, but there are concerns regarding using this test and its validity with antiseptics. There are also concerns regarding chlorhexidine's effectiveness. Much of the research has integrity problems. However, the following characteristics of chlorhexidine would be expected and are a cause of concern. 1, chlorhexidine is not effective against bacterial spores, such as those formed by C. difficile. Chlorhexidine should not be used in the major location of MRSA colonization, the anterior nares, and thus requires a second agent. Multiple studies have found chlorhexidine bathing to not be effective in prevention of CAUTIs. And finally, daily chlorhexidine bathing would not be expected to add much to CLABSI prevention when the catheter is placed with an alcohol chlorhexidine prep and then sealed under a plastic barrier. We also would like to encourage the committee to re-examine the surveillance protocols as exemplified by last CARB Meeting's VA presentation, which reported a dramatic decrease in MRSA infections in a high-risk population. And finally, I'd like to be able to submit a peer-reviewed paper on infectious disease research integrity for the CARB committee to review, and again call for the CARB committee to publicly disclose their conflicts of interest. Thank you.